Let's have a quick look into implants implanted into human bodies and their corrosion. Dental implants were the earliest implants that are known to have been used in the human body. Early civilizations carved wood or shaped metal into pegs to replace the missing teeth. For example, the Chinese carved pegs out of bamboo stick. The Egyptians formed precious metals into pegs, and the Incas made pegs out of seashells, like the circle ones in the picture. Biomaterials are considered non-viable materials designed to interact with biological systems to augment, replace, and repair tissues and structure in human body, like orthopedic, spinal, and dental implants. Corrosion is the irreversible loss of materials in contact with the environment through chemical reaction. There are different mechanisms for the corrosion of implants exposed to bodily fluid, like tribocorrosion, microbiological influence corrosion, galvanic corrosion, and stress cracking corrosion. These are all caused by different factors, and experts can distinguish them and therefore prevent similar corrosion cases. One negative consequence is the medical effects that corrosion products can have on the body. The corrosion mechanism produces metal ions through various mechanical processes, and particles can be caused by wear processes. Metal ions can cause a specific allergic reaction. This is not always easy to predict or diagnose. Here, an example is shown of an allergic reaction to titanium dental alloys, and the symptoms disappeared after the removal of the implants. In this case, the symptoms were rashes on the neck. Metal and metal oxide particles can cause a variety of health complications. Particles can cause metastasis, resulting in cell death and the formation of a so-called pseudotumor, which is a reaction of the immune system and looks like a real tumor. If the particles enter the bloodstream, they can cause general complaints like fatigue and weight loss, central neurologic symptoms like deafness and vision deficiency, and even more complicated health problems. This figure shows severe cases of affected tissues by wear particles and a pseudotumor. Here is an example of a patient with implant failure. A 57-year-old man with medical history of hepatitis C, diabetes, and rheumatoid arthritis who get a new artificial joint implant in the left hip returned with hip pain after 4 years. On the initial examination, there were no signs of loosening of the implant. However, the metal insert was seen to be completely dislodged from the acetabular shell and rotated approximately 90 degrees. During revision surgeries, metal debris was seen in the soft tissue. Also, metal debris participated into the bone and the surrounding tissue. Revision surgeries have more complications compared to initial replacement. They have extensive preoperating planning, specialized implants and tools, prolonged operating times, mastery of difficult surgical techniques, have higher health complication and risk of infection, and more cost of care. It is stated that the average hospital stay cost for knee and hip revision is 1.4 and 1.6 times more than the cost of the primary surgery, respectively. The annual direct inpatient expenses associated with early revisions reached more than $42.1 million in Canada in 2016 and 2017. Implant failure is a multifactorial issue and may consist of infection, instability, stiffness, fracture, wear, and loosening. This is not always easy to diagnose. To prevent corrosion-involved failures, implant failures should be investigated from different angles. This requires multidisciplinary and intersectoral collaboration between physicians, corrosion scientists, and manufacturers. Further details are available in the Corrosion of Implants Materials in the Human Body article. Thank you for your attention.